Good morning, Prof. Lacopia. I am Reignelle Quimoyog from BSN 1CS2, and today I am going to demonstrate the proper procedures of tepid sponge bath. To start, a tepid sponge bath is one in which the patient's body is being wiped with a wet cloth or sponge that has been soaked in tepid water. Tepid water consists of two parts, 1 part cold water and 1 part boiling water, which renders a temperature of about 40 degrees Celsius. But if the TSB is done to reduce body temperature in the presence of fever, the water used for the bath should be cool. Tepid bath's water at this point is 24 to 33 degrees Celsius. The purpose of this procedure is to give a half bath or to clean a particular site of the body, specifically indicated for bedbound, weak, or debilitated patients. And also, this can be used to reduce body temperature and stress in febrile patients when performed correctly. For the assessment, we have to check our patient's condition because this will serve as basis for evaluating our patient's response to treatment. Now, we have to assess our client's ability to assist in the bathing process as well as personal hygiene preference. Also, we have to review the client's chart for any limitations in physical activity. Then, we have to remind the patient to call for our assistance when getting up because the combination of the elevated temperatures and sponge bath could weaken the patient. And also, we need to assess for presence of external medical devices or equipment such as intravenous lines or oxygen tubing. And lastly, we have to observe patient for elevated temperature and review the doctor's order. Good morning, ma'am. How do you feel? Are you feeling something not right, like pain, itchiness, or anything?
Well, nothing. I'm good.
Okay, that's good. Will you be able to assist in bathing processes?
Yes.
That's good too. But still, if you feel like getting up or standing, you can call me so I can help you, okay?
Okay.
May I check if there's external medical device attached on you?
You may.
I will be needing to check your body temperature too. Extend your arm, please. Oh, now I'll get it na, ma'am. Oh, the temperature is 39.2. It's a bit high. But don't worry, I will be assisting you throughout. And I will be checking on your doctor and wait for his order.
Thank you.
Next, with the planning, I have here all the equipments that I need with the bathing procedure, including the bath basin, washcloths, tepid water, the bath and patient thermometer, bath towel, blankets, and patient's gown. I have here also rubber sheets or bed protector and the clean gloves. Now, speaking of the procedure, it must be done for at least 30 minutes to be effective. Also, constant monitoring of the patient's body temperature is essential so that it does not drop below normal. Then, we need to maintain a level of privacy throughout the procedures like closing the doors and the windows. And lastly, we need to adjust the patient's bed on a certain height that is accessible for working for the nurse to protect her back from strains. Proceeding with the implementation, it is important for us to call our patients by their name and explain to them what procedure are we going to implement. So, Ma'am Meg, I will be giving you a tepid sponge bath since your temperature is high and you definitely have a fever. It will somehow help us decrease your body temperature. Will that be okay?
Yes.
By this time, we have already maintained our patient's privacy by closing all the doors and windows. Now, we will continue with our hand washing and gloving for us to prevent the spread of microorganisms. This is important for us to follow these standard precautions, especially when we had contact with blood or body fluids. Then we will now be covering our patient with bath blanket and remove the patient's gown. We must keep the blanket over the body parts to ensure privacy and is not being sponged. Ma'am, can you remove your gown? I will be assisting you. Thank you. Then I will be removing your thin sheet. Then I will be using rubber sheet and dry towel to maintain the bed of the patient dry. Can you extend your arm? Now that we know that our patient has fever, we have to use cool tepid water which falls at a temperature of 24 to 33 degrees Celsius, since we have to decrease the patient's body temperature. Assuming that this is a bath thermometer, I will be using it to check if the temperature of the cool tepid water is enough. Okay, it is done. Then I will be placing 4 washcloths in the water, and be sure to squeeze it enough to avoid dripping, and apply 1 on the forehead. Can you please remove your eyeglass for me? Thank you so much. One on each axilla. Extend your arm, please. And 1 on the groin area. So we have to do this for 20 to 30 minutes and reapply the washcloths on their forehead and the axilla and the groin area if necessary. Proceeding, I will now be using 1 washcloth, wet, squeeze, and fold it into a mitt. Then we will be gently sponging the far side extremity first, starting from the hand up to the axilla, using the 4 different sides of the mitt. Then I will be drying the arm with the towel that I have placed a while ago. Remove. And place it on the other extremity. Continuing with the same procedure, I will be doing it again on the other side. Starting from the hand up to the axilla, using the 4 different sides of the meat. Then, I will be drying it again with the dry towel and remove. Then, let's now proceed with the legs on the far side. Continue with the same procedure. Starting from the toe up to the groin area, using the 4 different sides of the meat. Then I will be drying it again with the dry towel. And remove it. Next, I will be proceeding with the other leg. Next, starting from the toe up to the groin area. And I will be drying it again with the dry towel. And remove. Now that we are done with the arms and legs of the patient, let's now proceed with her back and buttocks. Using again the bed protector and the dry towel, we will be placing it on the back of the patient. Ma'am, can you position your arms like this? Thank you. And can you please lift your right knee up so I can easily turn you on your left side? On the count of 3. 1, 2, 3. I will be placing the blood protector in the dry towel. Using the same procedure, I will be sponging the back of the patient. Starting from the buttocks up to the upper back, using the 4 different sides of the mitt. Then I will be drying it again with the dry towel and remove. On the count of 3, I will be turning you again on your supine position. Thank you. So we are now done with the procedure, and I will be removing the washcloths that are on her forehead, axilla, and the groin area. And I will be checking again the patient's temperature to see if there is a change. We will just wait for about 30 seconds. Now the patient's temperature has lowered by 38.1. So we have to continue the process again once more. Oh, I'm done. I'll just need to check the patient's temperature again. Ma'am, can I check your temperature? Let's just wait for a few moments. Success! Your temperature is now slightly above normal. I guess we need to stop here and for you to rest and feel comfortable. I will now be covering my patient with thin sheet. As much as possible, we must avoid letting our patient have something on her or wear something that is heavy or thick. Now I will gently remove the bath blanket that I have placed here a while ago. Remove gloves. After you remove your gloves, proceed with your hand washing. Now that we are done with everything, I will just have to return the equipments used on their proper and clean storage and change the linens when necessary. I can clearly say that I have recorded the time when we started, including the time that we have checked the patient's body temperature and the patient's response. Now we have to do one last thing, which is to check the patient's vital signs like the body temperature, the pulse rate, respiration rate, and blood pressure. This is important for us to monitor the patient's condition as well as the treatment that he or she needs to intake. I will be checking the body temperature. Ma'am, can I check your body temperature?
Sure.
Let's just wait for some moments. Oh, your temperature is slightly above normal, so I guess the tepid sponge bath procedure that we have done effectively helped us to decrease your body temperature. Then I will check your pulse rate. Can I ask for your wrist? I have counted 82 beats per minute, which is normal. Next, I will be checking your respiration rate. Ma'am, can I ask you to breathe in and breathe out normally so I can count your breaths in full minute?
Yes.
Starting right now. Now it's done. I have counted 25 breaths in 1 full minute, which is normal. For the last one, I have to check the patient's blood pressure. I will be using this clock type desk blood pressure. Ma'am, can I ask for your arm? Make sure that the arrows here are aligned with the proper position. In placing the cuff, it is important to make it not too tight or not too loose to have an accurate reading. first, we have to find the pulse. Here. And place the stethoscope. One 20/80, which is the normal blood pressure. So, ma'am, how are you? Are you feeling a little better? Am I being too hard on your skin? Do you want me to be more gentle? Okay, that's nice. Thank you. All done. Thank you very much and have a nice day. Okay, ma'am. I will now be going. I hope you feel a little better now that I have done the procedures. Don't worry, I will be checking you again later. Bye.